Hi guys. So today we are going to talk about what to expect during your initial assessment or your first therapy appointment. So when you first come into EnSpire, there's going to be a lot of paperwork that you have to complete at our agency. I'm sorry. Also, if you're filing insurance, we will need a copy of your insurance card. If you are old enough to drive, we will need a copy of your driver's license. Now, for the initial assessment for minors, we do need the primary custodian to come in with that minor during the initial assessment. Now, for follow-up therapy sessions, if you would like anyone to transport your minor child, maybe you work, maybe it's difficult for you to bring them every single time to their therapy session, we absolutely will work with you. If you have a sitter, a grandparent, even the non-custodial parent to come and bring the minor child, we will just need a signed release of information in order for you to do that. So again, when you come in, you're going to bring in all that information. We're going to scan it into your chart, and you're going to complete our packet. We do have an adult packet and a child and adolescent packet, and also all of our information is found on our website. So if you want to go onto our website before your initial assessment, print the paperwork, complete it, and bring it in, you absolutely can do that as well. We do ask for you to come in about 10 to 15 minutes be earlier than your scheduled initial assessment so you can complete the paperwork if you don't bring it in already completed. So, what to expect during your actual session with the therapist. So when you come in, we're going to introduce ourselves. We're going to tell you about the services here at EnSpire Counseling and Wellness. We're going to tell you about ourselves as clinicians to let you know some of our past experiences. We're going to go over some legal parameters, the 4 areas under the law in the state of Georgia where we can breach confidentiality if we absolutely have to. Those 4 areas are if you're a harm to yourself, if you're a harm to someone else, or if you disclose any recent or current child or elder abuse. We're going to go over all of that during the initial assessment. Now, during the initial assessment, it is going to look different than any other counseling session. Providers like myself use our computer during the initial assessment because there's lots of nosy questions we have to ask during that assessment. We need to complete a biopsychosocial history in order to create a treatment plan that's tailored just for you. So we're going to get information, obtain information from you such as your past psychiatric history, any inpatient treatment, psychiatric hospitalization, inpatient counseling. We're going to obtain information as far as outpatient treatment, outpatient counseling, any substance abuse history, any forms of addiction, past or current, and if you're in recovery, how long you've been in recovery and how we can help you maintain your level of recovery. In addition, we're going to ask questions about your family of origin. We're going to ask questions as far as your present family, your living conditions, your living environment, your social environment, any occupational stressors, if you're working, if you're going to school. So as you can tell, there's lots of questions that we ask. We're going to ask medical history. We're going to ask about sexual orientation. We're going to ask about any spiritual beliefs. Is your faith important to you? We're going to ask if you're currently taking any medications, if you have taken medications in the past, if you have a relationship with a PCP or pediatrician or psychiatrist locally that we can clinically staff with or create a treatment team for. So again, there's lots of questions we're going to ask for the biopsychosocial. Then we're going to talk about why are you here and how we can be able to help you. Again, we're going to work together to create and tailor a treatment plan just for you. We want to meet your needs. We want to know what your treatment goals are. We want to know why you came in to EnSpire. We're humbled that you're here and how we can be able to help you. I know that some of these questions are really difficult. We're going to ask questions about trauma history. We're going to ask questions about bereavement and grief, about past or current abuse, exposure to domestic violence. We are absolutely sensitive when it comes to these specific questions. We do not have to go into a lot of detail during that initial assessment, but again, in order to tailor a treatment plan specifically for you, we do need to know as much information as possible. Here in therapy, we believe that you are the pilot and we are the co-pilot. We believe that you're the expert of your own life. Just sometimes things happen and we feel stuck or out of control, and hopefully our services will help you feel more in control, less stuck. So that's what is to expect during your initial assessment here at EnSpire Counseling and Wellness. Plan on being here around an hour. Sometimes it's an hour and a half, depending on how long it takes you to complete the paperwork and etc. If you have any questions, please feel free to call our office. And also look on our website. All the information, including the intake packets, are online at www.enspirecounselingandwellness.com. Thank you so much for taking time to listen to me today, and we hope to see you soon. Bye.